Hi, my name is Brenda Lormel Raymond, oncology nurse practitioner, founder and lead consultant for VDI, a healthcare consulting company. In the United States, breast cancer remains a major concern, impacting countless lives. Breast cancer is the second leading cause of death among women, claiming thousands of lives each year. Black women are particularly affected. Today, we want to emphasize the importance of mammogram exams. Breast cancer affects millions of women nationwide, but early detection can save lives. A mammogram is a simple, non invasive procedure that can detect abnormalities in the breasts before they can be felt. By scheduling regular mammograms, you're taking charge of your health and increasing the chances of early detection, which leads to better healthcare outcomes. We urge all women, especially those over the age of 40 years old, to prioritize getting their mammograms. It's a small investment of time that can have great impact on your health. Let's unite as a community to support and uplift all women in this battle.
Marie, she's our receptionist. She works Monday and Tuesday, and we have someone else that works Wednesday through Thursday. And I have my friend, my dear friend, Moses Rodriguez. He is a former mayor of Brockton, and he is the president of the State Health Council. So that's Moses. And everyone else can please tell what they do, who they are, and this is part of our team. And I have Layla. Layla? Oh. Oh, you helping someone? Yes. She's still helping someone? Yes. She's working with someone.
Okay. Well, we don't want to interrupt that.
That's okay.
We can introduce ourselves.
Yes.
Do you want?
Sure.
Do you want to start this time, or do you want me to
Sure.
start? Go ahead, Doug.
My name's Doug Gautreaux. I work in the Emergency Assistance Incident Command. I do a lot of the public community intergovernmental relations.
Bielkis Gonzalez, App Global Technical Assistance Provider, working with the United Way.
I'm Dana. I'm also a technical assistance provider with that.
Hi everyone, I'm Christy Staples. I'm with United Way. I oversee all of our policy and government relations work and work with Sarah.
Sarah.
Want to come around to me?
Yeah, one to Sarah.
Sarah Bartley. I lead our safe and stable housing work at United Way.
Yes.
Really glad to get to partner with you, and glad that we get to finally come down and see your space.
Thank you. Thank you for coming. So the partnership cannot be better, and the timing could not be better than that. So we're so glad to have that partnership with you guys, and give us the opportunity. More people joining us. Hi. And give us the opportunity to support our community and members of the new migrants that come into the community. We appreciate the partnership, and we hope that partnership continues.
Wanted to take some time here to do some introductions, give kind of just a high level of what the program is that we're here to see, and then we'll hand it over to you. Okay. Glad to have you do sort of show and tell.
Yes.
Love to hear the story for you about how the program came together and how it's going, the partnerships that you've made, how families are navigating, and then really just ask questions. Doug, you get a chance to ask questions. Christy, myself, we'll get to ask questions, and so that's the goal for today. So high level, this is really similar to the last program we were at, in the sense that it is using apartments, right?
Yes.
And so this has been an opportunity to get families immediately in housing, with the long-term goal of helping them navigate and really avoid going into shelter, because they're immediately in housing where they can put down roots, get connected with. We got kids in the schools, we've got kids accessing healthcare, we've got families able to work. So would just love across the site visit to hear more from you about how those connections are going, what families' aspirations are, what they're looking for, and how you do it as a program. So yeah, that's our purpose for today.
All right, so we will have a journey. So then we'll talk more about it and as we go along. So I know that you are planning to visit one of our sites. So I will be glad to bring you there as well once we're done. So to start, so when I sent you that email almost a year ago to say, hey, I would like to be part of this opportunity and join you guys to create an opportunity for the new migrant.com. It's been since February
Yep.
2024, and we started with looking for apartment. You said, Marlene, do you have an apartment? Do you have an apartment? I said, I will. And then you put the trust and said, you know what, send us a budget. And I know when I was looking for the apartment, Mr. Rodriguez was one person that I called, and then he said, wow, did you call so-and-so? And I said, no, I did not. And then he said, okay, I'm going to give you his number. And I called the gentleman, and he said, yes, I have 3 available units. So, and I sat with him, and we planned. I said, what is it? And we planned the logistic, the financial part, and then we sealed it. So from there, I said, okay, this is our budget. This is how many family that we're gonna be to accommodate. And then you and your team, you are very graceful and sit down with us and go to the logistic and what it's gonna take. So that was our first time doing things like that. So, but again, we had your support and your team support to help us navigate to the system. So that's what brings us here from 3 units to 5 units right now. So we are able to help 11 families and helping them in all the spectrum. So from the housing where we place them to the school, DTA, English as a second language, and healthcare, and put them with providers, pediatricians, and to navigate different resources in the community. So we help them with all this to make sure that they are stable in the environment that they are. So that's what we have been doing since February until today. So we have 11 families. All of them has the one that did not have their paperwork, the immigration status. So we help them with that. Everyone in our family has their paperwork. Only one family that has not, but they put paperwork for them. Everyone has a provider. All the children has a pediatricians, and all of them are up to date with their medical needs. And the one that does not have paperwork, but the only thing that's been a hurdle for us is finding jobs. So in May or March, we found out that in order for them, every job that they go, they call for an interview, and because they don't speak English, they cannot hold on to the job. So, and I said, okay, we need to change the way that we are doing things. So we did not provide in-home ESOL for them. So I said, okay, when you said we have the opportunity to extend the budget for another 6 months, and we said, okay, in that budget, we're gonna add ESOL as an in-home ESOL for them. So we added them, so most of our family come in here. So the new one that just started with us a month ago, they will start class next week here, but majority of them attended school here twice a week. On Tuesday and on Thursday, they come here for ESOL. So that helped them with the language base, that helping them with interview skills. So when they go for jobs, so they know whatever the job they put the application, we ESOL that with them so that they can hold an interview for their job. So that's one thing. So otherwise, we do help them with everything and anything that we can. Majority of them, we don't provide them food because majority of them has food stamp and they have cash benefits. So this is not, but the one that doesn't have food stamp or cash benefit, we do our best to provide them with food. Come in. We do our best to provide them with food whenever we can. So we are doing our best to make sure that every family are comfortable, and you're gonna see for yourself. So we have 3 3 different apartments. We're going to one of them today, so you'll be able to see how a family live. And our goal with this program is just to see if we can have them take over the list that we have with some of the landlord that said they will transition them from our program to the home base. That's the idea of the model that we are working on. So far we only have we have three different landlords, but one of them said they are willing to transfer the list to them. But we're still looking for them, so we have a housing engagement specialist that's working with them as well. So looking for partnering with different landlords, looking for apartment to see where we can transition them from where they are when the 6 months is done, so they can be on their own there. So therefore, that's what we do in a nutshell.
Yeah. So in this building, what happens here? So case management, ESL classes, what else happens here?
Oh my God, I'm sorry. So in this business space here, so every two of our apartment, we do have office in them as well. So
Okay.
most of, like in spring, we have an office there. So anything that pertaining to spring, so we have someone there dealing with them in that office. In Warren Ave, we have an office there as well. Anything that's pertaining to Warren Ave and Summer Street, so this office dealing with that. But here, mostly, it's our main office where if people come in for ESOL, because we do the classes upstairs, and any community member that comes for immigration services, DTA, anything that the community needs, they come here and then we put them in touch with whatever the resources that they're looking for. That's here. So our classes are upstairs, and the one classes we want to do workforce development as well, helping them with computer skills. So that's something in the pipe. And we just get a link from DPH to help them with home health aid training. So that's one thing that we're gonna work with them as well, to do workforce development with them, to give them something that, an extra skills, that when they're looking for a job, they will have that extra skills.
That's great.
Put on their resume.
Do you want to share just context, other programs that you offer? Your organization wasn't new with Safety Net. This is the latest thing you're doing.
Yes.
But what else does your organization do?
All the things that we do, we we have a youth leadership program that we work with the school, that we go to BROCKTON High and the charter school, so where we do after school program and have the youth, it's like a mentoring program, so some of the youth be the mentor to helping other kids who have difficulty with whatever the subject matter they have difficulty, so those youth helping each other to make sure that their peers are on top of the skills that they need. So this program used to give those youth a stipend to help the other youth, and through a grant through Department of Education. So we hope next year we'll still have the same rate to continue this program with the high school. And we are working as well with the YMCA on gang violence. It's through the youth program as well, so where we provide education to the youth regarding community engagement and resources to the community, and to detail them from other activities that are pertaining to the growth in the community. And we do mobile mental health, where we educate different community members, mostly in the churches, where we go, we do mental health awareness, psychological first aid, and youth mental health awareness as well. So through different churches we go, we do those workshops to make sure the community aware and be able to help their community members when they have an emergency, they can support them. And we partner with the Cape Verdean Association, we partner with the BROCKTON Neighborhood Health Center. We have a big partnership coming through the school with the BROCKTON Neighborhood Health Center and the Cape Verdean Association.
Basically to work with young people who are interested in the medical field, you know, for us to basically, because we have a major crisis in terms of having, you know, nurses, aides, radiologists, dental assistants, and so any young person that has an inclination towards those fields, we're actually working with them by having general sessions to talk about those issues on a regular basis, and then we're going to focus on individuals where we're going to pick them up this year. I think in September we're going to pick them up in the junior year. About 10 individuals that we're going to work with through the junior year, through the senior year. But it's a 5-year program, so next year our goal is to involve 25 to 75 young people who have in mind, that they want to follow the medical profession, in the sense to kind of work with them, provide a little stipend to them, basically hold their hands and walk them through the process to make it a lot easier for them.
Yeah.
And the health center is the health center, and then because we also at the association, we deal with the Latino community, which is another aspect of where a lot of the Ecuadorians, the Hondurians, and some of the other folks that we're dealing with are having those issues as well, because in the Boston area, those communities are well off, but in Brockton, they're the forgotten few. So we have the community advocates that we have up there kind of traveling to New York. One of them went to New York the other day to help somebody basically get a passport, because there's no place to get a passport around this area. So they travel to New York with somebody, into Boston, into the immigration, into all these other things, and we do it basically within our own budgets. We don't get a dime from the state, we don't get a dime from anybody, because there's a need in the community, and that's what we try to do. We just entered into a partnership with St. Patrick's Church, that we're going to try to work with those new arrivals, try to come up with some sort of because most of us are multilingual in Cape Verdean Creole and in Spanish, so it makes it a lot easier to work with those communities as well. But we're going to be doing that because, again, they are in la la land when it comes to Brockton. Brockton is the forgotten community, and it's almost embarrassing that we're dealing with the United Way of Boston, basically. And when we have local United Ways all over these areas that basically don't do much in terms of working with families and communities in this community. And it's not just the United Way, it's a variety of other organizations, for instance, that they come into our community, reap the benefits of this community, but yet kind of isolate back into their own communities. And to be honest with you, we are a suffering community. Brockton is one of the more violent communities in Massachusetts. We're the only majority black city in Massachusetts and in New England.
Yeah, in New England.
So, but it's sad that the only ones that know that are folks like us in this room, it's a shame that you apply for grants that are supposed to be for black communities. We don't get it because other communities are getting it from, they're promising to do some things and it doesn't come down this end. And yet we have to deal with the violence that we're dealing with. We have to deal with the homeless issues. We're the catch-all for everybody because we're the only city in the county.
Yeah.
And not surrounded by larger communities.
Hospital.
It's interesting how when you put all the populations of the towns that attach to Brockton, it doesn't equate the population of Brockton. We actually have more children at Brockton High than there are people in Avon. And that's the situation that we face, and we're basically on our own. Our city, it's not a rich community. Our resources don't go as far as they used to, and we're really struggling in terms of, providing the services that we need to provide to our communities, and we see it every day. I mean, I see it from the community aspect, from being the exec at the association to a member of the city council, actually the president of the city council. I mean, I see what comes in, what's going out, and it's not going out for services. It's going out just to, pay personnel, pay the police and fire and the schools. And there's not a great deal of resources that are going into infrastructure to do things and build things for the poor folks in the community. And I'm just in awe when she told me that you guys were coming down, and I'm like, I don't care how tired I am from last night. We had a large festival here in the city, so some of us had very little sleep. But I wanted to come here just to personally thank you for coming into this community and being willing to march down here and see the struggles and sacrifices that we're going through. Because a lot of it is being done, there's an old saying that says you do it with duct tape, we do it with Scotch tape. We can't even afford duct tape. So that's how we're doing it down here. When you see the great work that organizations like Marlene's and others are doing in this community, it's more work of love than a job. You know, I mean, I gave up $20,000 to come and run the association because it's your community, so any little thing that you do, you know, it helps out. We've got now a Haitian class going
Yes.
on every single Monday, Wednesday, and Friday. You know, these are the high advanced ones that we're actually looking to place, along with Catholic Charities, to place them into the higher positions, in a sense, because it's more advanced English skills and more directed towards the health field in a way. Because I think their goal is, once we get them, you know, sufficiently speaking the language, is to move them into, you know, not necessarily a CNA program, but something a little more advanced than a CNA program, you know, like a pathway into bigger and better things. But again, it's done with Scotch. You know, whatever we can take together to get things done, that's the way it's been done. You know, I seriously appreciate you folks coming down to look into the eyes of some of these poor souls that we're dealing with, because it's not very easy. I mean, for some of us that actually speak various different languages, you look at English is by far one of the hardest ones to learn. You know, people don't realize that, you know, it doesn't matter. I mean, I came to this country when I was 16 years old, and it's not simple. It's not easy to learn this language. There's so many of the, you know, silence here, silence there. You don't pronounce this here, you don't pronounce it there. And that's not the way it is with, you know, with the Latin-based languages that we all speak. So it's difficult. So when somebody says it's hard to learn, trust you me, it is hard to learn. So I'm glad you guys are doing this.
And I want to piggyback on what Moses said regarding the languages, the English classes. Majority of those migrants that here that we are servicing, majority of them left the country with a degree, either doctor, engineer, teachers, you name it. So they do have the credentials. So, but the English preventing them from, you know, assimilate and, you know, involve in what needs to be involved. So that's why we are focusing on give them that skills, give them that tools to help them navigate the community that we are settled in, so we can support them. So.
Well, we're really excited to have organizations. We were really particularly interested in organizations that could bring Haitian cultural experiences to this program. So really glad to have forged a relationship with you, a partnership, and to have you starting to rent apartments and be able to help people transition housing. As I think housing is one of the more difficult supports to navigate, and yet housing is the foundation of so much else we need to do in our lives, whether it's education or getting a job, our healthcare. So we're really glad to be able to work with you in this way, have technical assistance there to support you with anything that you need. Anything else folks want to share while we're here before we?
I'll just add one thing, Marlene, a great thanks to you. I don't know if you remember, but we have Ending and Preventing Homelessness Caucus.
Yes.
And we asked Marlene to do a favor and speak about the program and the important work. And you graciously said yes, and came and presented to the caucus. And I think there were like 15, 20 legislators listening in, and so really talking about the important work. And so thank you. You took time out of your day to do it. So I don't know if folks knew that Marlene had done that, but it was really amazing, and everybody was very, very impressed and grateful.
Yes. So last 2 years ago, we had a grant with SBA to be the navigators for SBA helping small businesses in the community. So the Cape Verdean Association put for that grant that we were, Haitian Community Department was one of the spoke for this grant. So where we help many businesses to get the grant that they didn't think that they would be not aware of it. So that's one of the things, though, having small organization involved in the process benefit from some grant. So it goes a long way. So we were able to help thousands of business owners through that grant. We created an organization to help small businesses, and that we continue. The grant is over, but we continue to help the small businesses through that grant. So hopefully, if Congress play well, so we might have the grant again. But again, so it's one of the It's one of the great benefit from when you work with local organization. We goes a long way, and the community benefit from it. So that's one of the services that we provided for the past 3 years. Right now we're going to our third year.
Yeah. Well, it was interesting because one of the things that we were looking as a social service agency, we were helping, folks through COVID, with unemployment, looking for housing, masks, vaccinations, and all that other stuff that everybody else was doing. But one of the things that we've noticed, a lot of our small businesses, mom and pop small businesses, were struggling as well. And they couldn't apply for the PPP programs and some of the other benefits that existed out there. A lot of them went out of business and never came back because of COVID. We now have about 156 small businesses that we deal with on a regular basis. And as Marlene was saying, the program ended in this past December because it was a 2-year pilot program to help these businesses navigate. We continued it because what she was saying, we created this organization called the Greater Brockton Minority Business Association, which again, as I mentioned earlier, being the only black city in New England, we don't have a minority business association. So we created one out of that grant, and that basically is now walking on its own, beyond the grant, and if you sit down and think about it, most of the small businesses, and it was actually interesting because people were saying, what is a social service agency doing with small businesses? I think we were there was like 700 and something applications to this pilot program nationwide. They selected 51 and we were one of the 51s.
Yeah.
And I think the only social service agency, and people were like, what does this have to do with businesses? And I said, well, it goes hand in hand in a sense, because once you help the individuals, a lot of our small businesses are also individuals in our communities, some of which had no idea what a EIN number was. They were running their businesses with their own social security numbers. They had no idea what registering with either the state or the city itself to register their businesses. So anytime something came down the pipeline to benefit these small businesses, they're like, well, give us your certificate of good standing. What is that? Because you're not really, into the Commonwealth's data and things like that. So it was those, business plans. They had never heard of that. The vast and very successful businesses in the community had never heard of any of those things because they're doing their thing. The restaurants, the hair salons, the little stores, they're doing their day stuff, and they're not really thinking about that there's a pandemic coming, and then we might have to shut down and try to survive in a sense. So this is what this organization and us did and continue to do. As a matter of fact, we have a meeting schedule because we continue to meet with them on a monthly basis. Bring in new, grant opportunities, loan opportunities, and things like that, because the vast majority of these folks had never heard of SBA. We think it's that everybody should know what it is, but they have no idea what it was. So just to get them into that fold and have, by the way, there's some loans that you can apply for a lot with better rates than everybody else, not through to a traditional lending thing, is a way to kind of provide these services to them. And that's one of the things that we've done and we're going to continue to do. I think on the 18th we have another meeting coming up.
And then those are small businesses that hired some migrant
Of our own people, yeah.
and in the community as well. So it's a win-win.
Yeah.
It's a win-win.
So does that small business association provide kind of a gateway to employment?
Yeah.
Yes,
Yeah.
yes.
So that's who you utilize first.
Yeah.
Like
That's
one of the
great.
things that we're doing, I think we're providing just the summer jobs. We have a ton of those migrants actually working in those summer jobs with smaller kids.
Yeah.
Throughout, I think there's 60 people altogether, and a lot of them are migrant workers. I mean, not migrant
Okay,
families,
yeah.
and they're teenagers. Slightly older kids are working with younger kids, and even the program, there's a bunch of migrant children in those programs as well.
I think these kinds of cultural civic programs are what often a lot of our traditional housing organizations don't necessarily do, right? And so that's been what's been really neat benefit of bringing an organization that has these kind of cultural and civic relationships into a program like this. We could learn a lot from them. So thank you for the chance to get to know you a little bit more.
No, thank you for giving us the opportunity to work together with us. So appreciate that.
So we're going to see, you want to go see an apartment?
Yes, we're going to see an apartment.
Okay.
We're going to Spring Street.
Okay.
Hi, my name is Brenda Lormel Raymond, oncology nurse practitioner, founder and lead consultant for VDI, a healthcare consulting company. In the United States, breast cancer remains a major concern, impacting countless lives. Breast cancer is the second leading cause of death among women, claiming thousands of lives each year. Black women are particularly affected. Today, we want to emphasize the importance of mammogram exams. Breast cancer affects millions of women nationwide, but early detection can save lives. A mammogram is a simple, non invasive procedure that can detect abnormalities in the breasts before they can be felt. By scheduling regular mammograms, you're taking charge of your health and increasing the chances of early detection, which leads to better healthcare outcomes. We urge all women, especially those over the age of 40 years old, to prioritize getting their mammograms. It's a small investment of time that can have great impact on your health. Let's unite as a community to support and uplift all women in this battle.